In this video, we're going to discuss what to expect at your very first prenatal visit. If you want to learn more about natural hospital birth, subscribe now. Most of us anticipate our first prenatal visit with tons of excitement. But if this is your first baby, you might not know what to expect. There's not a gold standard about when your provider will want you to come in for your first visit. Some say to come in as early as 6 to 8 weeks, in which case the main purpose of the visit will be to confirm the pregnancy. They'll likely draw blood to test for HCG instead of relying on urine testing alone. And they may have a nurse gather your health and medical history on that visit. Some providers have you wait until later, maybe as late as 10 to 12 weeks. Or it could be that you called but just couldn't get an appointment until you were in that 10 to 12 week time frame. Each office is going to have its own slightly different routine, but here's what you can generally expect. A urine sample. After you check in, they hand you a pee cup and ask you to provide a urine sample. If you haven't done this before, I've provided a link below to a blog post entitled "How to Provide a Clean Catch Urine Sample" to answer any questions that you might have. In each visit, they'll test for excess protein in the urine, which could indicate high blood pressure or a urinary tract infection. They'll also look for excess glucose in the urine, which could indicate gestational diabetes. Vital signs. Then a nurse will check your vital signs, namely your blood pressure and weight. Like the urine sample, you can expect to do this at every visit. Nurse intake. At this point, you'll be brought into a private room where you'll sit with a nurse and answer questions as they look through your chart. They'll ask about how many pregnancies you've had, including past miscarriages. They'll ask for a list of any medications you take, so be sure to bring that along. Be as transparent as possible about your medical history. Be sure to discuss any medical conditions, including but not limited to diabetes, seizures, depression or anxiety, high blood pressure, allergies, prior surgeries, or any problems with anesthesia. As the nurse leaves, expect to be given a huge packet of information about the practice, the hospital, and pregnancy in general. Heartbeat. If this first appointment is around the 10 to 12 week mark, they may try to listen to baby's heartbeat with a Doppler unit. Now, this can't be done earlier than 10 weeks, so don't anticipate this if you're earlier in your pregnancy. How is this done? You pull your pants down low to the bikini area. The nurse puts some gel on the handheld Doppler unit and moves it around slowly until the heartbeat is located. It is super exciting and super validating to hear your new baby's heartbeat. Meet with the doctor or midwife. Next, you'll meet with the doctor or midwife. The nurse may hand you a gown or sheet and instruct you to take off everything from the waist down. If this is the case, at some point during your visit, your doctor will likely feel for your cervix and press around or palpate your uterus. Your provider will then review your chart and the information you gave the nurse earlier. He or she will give you lots of great information to help you have a safe and healthy early pregnancy. And now is the time to ask any questions that you might have. If you're anything like most of us, you're probably going to have a lot of questions. A blood sample. Last but not least, you will likely have blood drawn by a phlebotomist. They test for a whole slew of things with this first blood test. These tests typically include a complete blood count or a CBC test to see if you're anemic, blood type and Rh factor status, MMR titers, hepatitis B antigen, rubella immunity, HIV and syphilis test. On your way out the door, you will head to the appointment desk and set your next prenatal visit. This is often done at around 13 weeks. They may schedule an ultrasound at this visit where they assess the baby for size and try to establish an accurate due date. And then that's it. Your first prenatal visit is in the bag. Are there any other questions you might have about what to expect at your first prenatal visit? If so, please share in the comments below, and we'll do our best to answer any questions you might have.